I'll do a quick introduction. My name is Catherine Shepard, and I'm the Education Coordinator with the Alzheimer's Society, and I'm sitting in beautiful Cape Breton right now. The sun is shining in through my window, so I hope it's shining where you're sitting today as well. This afternoon's presentation, Be Steady, Be Ready. So get ready, everybody. Here we come. A reminder, just as Beth told us, that this session today is going to be recorded, so that's why we have our cameras and microphones of everybody attending turned off. Our audience today will include people living with dementia, people caring for someone with dementia, and people who want to learn more. So today's topic, Be Steady, Be Ready, is a topic that we've been getting lots of questions about, and so we thought it would be a great presentation to provide to you all this afternoon. Our presenter today is Suzanne Baker, and she has been the Fall Prevention Coordinator for 14 years with the Department of Health and Wellness and Nova Scotia Health. Her background is kinesiology, gerontology, education, and exercise physiology. And the presentation today will be about the importance of moving and exercise. The move it or lose it concept will be discussed today as a strategy for the prevention of falls. So we'll have about a 20 to 30 minute presentation, a few minutes for questions and answers at the end. So just a reminder, if you do have any questions as we go through, type them into that chat box, and don't forget to hit enter to send them along, and we'll answer those at the end. So it is my great pleasure now to introduce Suzanne Baker. So we'll join back up with you, Suzanne, at the end of your presentation. I look forward to hearing all of the great information you have to share.
Thank you. Hi, folks. My name's Suzanne Baker, and as mentioned, I am the Fall and Injury Prevention Coordinator working for Nova Scotia Health. I've been doing it for a while, and you've heard what my background is, which is all over the place. And it's always funny because I do watch tons and tons of webinars and education sessions, and I always am very interested in people's background to say, okay, why are they able to do this education presentation? What makes them sort of an expert, or, what do they do? Well, I think my background speaks a little bit for that and what I've been doing, but then we have the piece about dementia and Alzheimer's, and how do we deal with that? So just to give you a little bit of background, my grandmother and my mother both had Alzheimer's. My grandmother actually fell and broke her hip and went into the hospital and ended up in long-term care. And my mother also had Alzheimer's, and she also fell, broke her hip and her arm in two places, and ended up in the hospital, then subsequently ended up in long-term care. So I have some personal experience with it, and so I can bring it from both sides, from the evidence-based side and also from the personal side. So feel free to, if you have questions, like you said, put them in the chat box and we'll get started. So Be Steady, Be Ready is like, it's just about what do you need to do. And this is just, it's not only for the people that have Alzheimer's, but it's also for the caregivers and just for generally for older adults, to keep in mind. So one of the things is that this was highlighted by a physician that I've worked with, Ken Rockwood, who is in Halifax, has a geriatric clinic. He's a geriatrician himself. And he says, our work on frailty has highlighted the vital role of physical health and fitness in preventing and delaying dementia. So he says the impact of regular, vigorous physical activity on brain health cannot be overstated. So it's that whole thing about, we really need to keep moving. We need to, continue for that. And it also, there is evidence that supports that it can help to shorten or actually slow the process down when it comes to dementia. So it's really important that we think about that and the importance of it, plus all the other benefits that go with it. So I have a short video. So here comes the technology piece, because I'm going to try to share this with you and make sure that it actually works. And we have a little video to watch, and I will start the video.
Hi, I'm Dr. Mike Evans, and I'm presenting this visual lecture called 23 and a half hours in partnership with 24-Hour Fitness. It's great to be working with people who have a passion for helping others achieve their individual fitness goals and promoting positive change in their lives. So I have a big interest in preventive medicine, which can mean a lot of things from, cancer screening to eating more fiber to having a good social network. And I mean that in the old sense of the word. Weighing less, drinking less, smoking less, controlling your blood pressure, cholesterol, and so on and so forth. So all of these things are incredibly important, and I wouldn't want you to minimize your efforts in any one category. But I want to know what comes first. What has the biggest impact? What has the biggest return on investment? What makes the biggest difference to your health? So I did my research, and I found an answer, at least for me, and it's tricky because, all these things are sort of overlapping. But I picked out this intervention, and because of its breadth, it worked for so many different health problems, and that's what I found so cool about it. So just to kind of walk you through a quick list. So this intervention in patients with knee arthritis who receive 1 hour of treatment 3 times a week reduced their rates of pain and disability by 47%. In older patients, it reduced progression to dementia and Alzheimer's by around 50%. For patients at high risk of diabetes and coupled with other lifestyle interventions, it reduced progression to frank diabetes by 58%. Following over 10,000 Harvard alumni for over 12 years, those that had the intervention had a 23% lower risk of death than those who didn't get the treatment. It's the number one treatment of fatigue. And of course, the kind of outcome of choice, or my favorite outcome, is quality of life, which is really all of the above and really about making your life better. And this treatment has been shown over and over again to improve quality of life. So the question is, what's the medicine and what is 23 and a half hours? So the medicine was exercise, mostly walking, so not triathlons. And let me just put it a different way. I think what I'm asking you to do is, if you think about your typical day, so there's 24 hours, and so you might spend most of your day, this varies obviously, but couch surfing, sitting at work, obviously sleeping. And what the evidence that I'm going to show you kind of tells me is the best thing you can do for your health is to spend half an hour being active, maybe an hour. And that if you can do that, you can realize all the benefits I described in the previous slides. So if exercise is a medicine, what's a dose? So when I think of dose, I think of how long, how often, and how intense. I'm going to give you a slightly mixed message, but essentially more activity is better. But I must say the rate of return seems to decline after 20 or 30 minutes a day. So if you're being active less than 150 minutes a week or more, if you're a kid, an hour a day if you're a kid, my flag goes up in the clinic. So my personal take on this is that, the literature draws a very broad brush. And so we see big differences when somebody goes from not doing anything to doing something. And after that, the return is more granular. So if we took the Nurses' Health Study, women who went from zero activity to just 1 hour a week reduced their heart disease rates by almost half. So you can break it down. So it can be 10 minutes, 10 minutes, 10 minutes if you want to do 30 minutes of exercise. So it can be broken into 3. If you're only going to do it if it's pre-booked with friends, I have couples that take a half-hour walk every morning or evening to organize their life. A dog is a great walking coach. The data is showing 67% of dog walkers achieve the 150 minutes a week just with the dog walking. And finally, of course, your commute, getting off stop early, taking the stairs, and so on and so forth. The next way to think about it is the reverse. So what I call sitting disease. We know that being sedentary is bad for your health, but a researcher named Leonard Veerman wanted to quantify this, and he did so down in Australia in a big study they did there. They found, compared with persons who watch no TV, those that spend a lifetime average of 6 hours a day watching TV can expect to live about 5 years left. I mean, that's incredible. But then I think, who watches 6 hours a day of TV? And it turns out the average adult in the USA spends about 5 hours a day watching TV or screens. So I find this fascinating that we never think of the TV as something that's bad for our health, but clearly it's as powerful as many other risk factors for chronic disease. So I'm going to finish by asking you a question. And this may have some personal challenges for you. So, you might be very busy with work or kids or both, and you may be in pain or have other priorities. But my question to you is, can you limit your sitting and sleeping to just 23 and a half hours a day? So whether it's hitting the gym and attaining fitness goals or walking the dog or taking the stairs, get out there and be active. Thanks again to 24 Hour Fitness for bringing you this message.
Okay.
Things you should never mix with water. Mascara. Home electronics. Sodium metal. Witches! But do you know what really shouldn't have water added to it? Laundry detergent. Why? Laundry detergents like these can...
Oh. Okay. So can everyone see my screen? Can you see the presentation?
We can see you right now.
Oh, well, where is my screen sharing thing?
If you come back to your PowerPoint,
to my
you might have to
meeting.
reopen
This is what happened yesterday.
it.
Okay.
We're all in this together.
Okay. So
Don't worry.
this is where I am. Can you can't see it though, can you?
Not yet.
Am I sharing my screen? Mm.
One of the wonderful things that we've learned with COVID is how all of this technology is so changing, so always changing and growing.
Exactly.
Yeah, that's okay.
So I don't know why it's not there. It's disturbing for me. So, whoa. Share screen. Share screen. Share.
There we go.
Is it there?
It sure is, and you can just make it your full screen again now, and that's it. Perfect. There you go. On your feet again.
Okay, here we go. So I think it's really important when you watch that video. I think it's important because it's not only for, you know, doing that 1/2 hour a day. I think of myself because I do sit at my desk quite often. I have a lot of electronic things. My children bought me a Apple Watch that reminds me to stand up every hour because otherwise I get very, you know, tunnel vision into my work. And so it reminds me, so I get up, and when that reminds me to do that, I go and get a glass of water, because then I'm drinking my proper amount of water every day. That I've got a check-in from 2 adult children all the time asking me those things. And then it also records your activity. So, you know, it actually gives you that guilt sort of jump also. So I think it's important, especially during COVID too, because exercise helps us in many ways. And also, if you are doing some exercise and you're with, you know, a loved one, like if I was with my mom, I would take her to exercise. She never participated. She liked the music, but it was social for her. And I could see a difference in her mood just from being there. So I think that's a really important piece. So it's not necessarily always like, you know, the active part, but there's other parts that are also very positive. So this is called the beach prevention model. This comes from the Canadian Falls Prevention Curriculum. And it's just a model in terms of when we want, it sort of represents a multifactorial approach. And that means what kinds of things can we do? So it tells us clinically that the experts tell us that the most important component of fall prevention is behavior change. So right when you stop and think about that, for us, you know, if we don't have any sort of cognition issue, then yes, potentially we can change our behaviors. So changing behaviors like, well, I never, you know, I don't walk every day, so I'm going to change that behavior, and I'm going to potentially walk every day. So I think that's something that, you know, that we want to consider. So when you start thinking with the older adult in terms of change, and if they do have a dementia or Alzheimer's, it's very difficult, obviously, to change behaviors. And so maybe sometimes it's us changing our behavior so that we can be there to care for them and help them in terms of someone's safety. So changing our behavior in terms of helping someone in their home be safe. But it is a core element in terms of prevention. So other areas around our education, that's of course really important in understanding and what you're doing today. Equipment in terms of, you know, does that person have the appropriate mobility aids or assistive devices that's going to help them? So like I say to everybody, our message is that yes, we don't want people to fall, but people will fall, especially if we're promoting them to be mobile and being up and moving. So it's important to remember that we don't want people to actually get hurt. So if we're promoting mobility equipment, if using a cane or a walker, that's going to help you to move, then it's perfect. So when my mom fell, they gave her a walker, and because she had Alzheimer's, she didn't realize that she actually had broken her hip. So she was very easy to get up and go on a walker, and she went away, and she did awesome. So I think that part, of course, and it kept her very, very occupied, and it made her feel better in many ways that we'll talk about. So equipment, yeah, is that going to help to promote somebody? So really having a walker is promoting some independence. And I think that's really important too. And then it increases that key issue that we talked about and that was mentioned by Dr. Evans, was the quality of life. If you're moving, I think everybody feels that much better. And then we look at environment, and the environment's a huge one. So where your family actually, you know, where you live within your home, and then also outside. So that's something that we can really control, is our environment. And there's a lot of safety issues and safety things that we can actually look at in terms of making the environment right for somebody so that they're not going to fall and they're not going to hurt themselves. And then we get into clothing and footwear. That's also an important piece, like the footwear. Are you wearing something that's a good fitting shoe? You know, have you looked at those shoes? Are they worn out? You know, at what the treads look like? Again, that's a key piece in terms of fall and injury prevention. And clothing, because sometimes as we get older, some of our clothing does not necessarily fit us the same way. And, you know, some of us might be leaning over more, so clothes might be hanging down, or we've lost weight. And, you know, so we don't want those to become a hazard either in terms of tripping or falling. And then the other one is health management. So annual medical checkups are really important for people. I think that basically, sorry, I lost my train of thought. I don't know if we still do the annual medical, you know, checks, but medication reviews are huge, especially for falls. And again, another thing that can be controlled, you can go into your local pharmacist and have a medication review. And sometimes there's a cost, but basically what they do is they look at all the medications and find out how they interact with each other to see if you're on the right number of prescriptions and the right, you know, amount in terms of your dosage. So that's an important piece. Annual vision tests, because of course, if you can't see well, then you also increase your risk for falls. Your hearing, because your balance might be off. And then we have to look sort of at that bone and health and fracture risk also in there. Nutrition and hydration, obviously, are really important aspects too. And our chronic disease management. I actually read a report this morning by Dr. Tam, came out in 2019, she's the chief medical officer for Canada. And she was saying how we are having a bit of an increase in our chronic disease. So to combat that, doing some type of exercise is always a bonus. So it's really important to keep moving for a balanced life. As we do get older, and I am getting older myself, although you tell some people and they go, well, you're not old. You're not old till you're like over 100, I guess. But aging can start to affect your balance, your muscles, and your joints. And so, I mean, I did a lot of exercise when I was younger, so I'm starting to feel that, and, you know, bad knees, but you still have to sort of decide, okay, I can feel that, so I'm not going to maybe do that high intensity kind of class. Oops, sorry. I don't know what happened there. I'm not going to do that high intensity class. I'm just going to, you know, sort of do a little low key and not move up to that level. So again, that whole piece about making it worse if we sit, you know, spending long periods sitting down. They keep saying sitting is the new smoking. I don't really think that's true because it's not affecting my lungs. But at the same time, yes, being sedentary is not beneficial. And the more active that you actually become, it actually can offset the effects of us aging. And so then you say, okay, well, what can I do? Well, we saw from the video, yeah, you can walk for 30 minutes, but there's other things. So it's not necessarily going to that programmed fitness class. If you like that, that's fine. Not everybody likes that. But gardening, you know, if you're outside, my partner's mother, she gardens sometimes 3 to 4 hours a day, and she's 86. And I know that's exactly why she still is living at her home and independently, and she loves it. And so it's just something that keeps her active. She also loves to do housework, and she does it every single day. Like she vacuums every day and she washes, and she does quite a bit. Just going for a walk and walking somewheres, or if you're in the mall, it also is beneficial. So we can do an exercise class, some of the fun ones like Zumba Gold, which is a dancing class, which is very fun. Yoga and Tai Chi are actually really beneficial too for older adults. The whole piece on stretching and with yoga and Tai Chi, I think it helps too in terms of your balance, which is one of the issues that happens. And as we age and get older, we tend to lose our gait and our balance and flexibility. And so those are things that we need to work on, and that's some of the ways that we can do them. So there are the greatest risk for older adults realistically is living an inactive life. And there's lots of benefits to exercise. So older adults that want to live and I think generally want to be independent. And I think if you exercise, it's going to increase that, that you are going to be able to actually, you know, benefit from them. So in terms of, you know, falls, we have to remember are not a natural part of aging. People keep thinking, oh, well, as I get older, I'm just going to fall, but that's not true. Maintaining your muscle mass, strength, balance, endurance, and flexibility, that's the best way to keep you on your feet. And that whole thing that I said at the beginning, when I was introduced about that old saying, you have to move it or lose it, is very, very true. The good news about exercise is that it can actually help us to prevent falls. It helps us, you know, to reduce falls, and it will actually help us to reduce injury if we did fall. So that's an important piece. Exercise helps you sleep better. It helps to improve your mood, and it also helps to prevent other types of diseases, diabetes, dementia, like we already said, and then there are some types of cancer. And then if you feel confident about moving, I think that's also beneficial, and it helps you. So what do they say to do? Well, we say that you know, what we need to do is, I don't know why it keeps doing that. 30 minutes of exercise every day is what you should do, or 30 minutes of walking. I always hate saying exercise because I also feel that a lot of these are just, it's functional mobility. And what do I mean by functional mobility? I mean that you will be able to maintain some of your independence in your home, and then you also are helping. So if it was like my mom and I was doing some functional mobility with her, it's going to allow her to get up out of her chair easier. It's going to be able to help her get up off the toilet easier. There's lots of positives towards doing those kinds of things. If 30 minutes is too long, then you can do 10 minutes. If 10 minutes too long, you can do 5 minutes. It all depends, and you should do things that you enjoy. You know, I mean, I don't like running, but sometimes that's something that I do, but I really wish I did, because it's something that it makes it so much easier to go and do it. So strength and balance exercises, things like stair climbing. If you're going up and down the stairs, of course, with help or holding on, that's an excellent way to gain some strength and balance. Our endurance, even walking is very helpful. Swimming is great because it's easier also on the joints. And then flexibility, as I said, the key thing and the key piece here is stretching. So one of the things that's really, really important to know is that you need to really consult with your physician before you start any exercise program, and be safe. You also could have physio come in and you can talk to physio, but starting very slow and easy. So you never should really just go out and start. You know, for me, when I start something, I do talk still to my physio and say, hey, this is what I'm going to do, knowing my issues, because I do have a bad knee and I have other things going on. And so it's really important for us to make sure that we start slow, and we do talk to a health professional to make sure that we're okay to start and there's nothing going on. So the buddy system, so this is the system that I think that really works. I used to have a buddy that I worked out with, and we guilted each other like all the time in terms of doing those exercises. But it's also fun because what happened was we would have fun and we would socialize. So I often would go, when I would go see my mother, and a patient that had Alzheimer's, well, my mom had lost her ability to speak. And she did not know who I was. She actually thought I was her mother. But when I was there, I tried to do simple little exercises with her just to get her moving and engage her a little bit. So it depends too, right, at which level the person's at, whether they can remember, or you have to reteach them every single time, which is fine. And we just have to remember, when we do any type of movement, it helps no matter what, right? Oopsie, I want to go back, sorry. I'm trying to get rid of this thing up there. So plan to do something every day if possible. And I think that's really important, that if you do that, also if you have someone to do it with. So also a key piece is to think about, I don't know why that's still there. Anyway, before you start doing any exercise and you've checked to make sure that it's okay to do the fault with your physician or with a physio, you should ask yourself, okay, that day, do I feel okay? And have you eaten? Because I mean, really, you don't want to start something and have not eaten. Are you wearing the proper shoes so they're not going to slip? And make sure in your space is a safe space so that there's no clutter or, you know, anything that you're going to trip over. So these are exercises that comes from the Canadian Centre of Activity and Aging. And what they are is they're actually, they were meant for a program where it's called the Tiered Exercise Program. And it was meant for home support workers or continuing care assistants that come into the home. And it was meant for them to be taught to them. And so these are the level 1 exercises. Basically, these exercises are just for functional mobility. And what functional mobility means, helping someone to be able to be independent as they possibly can. So just doing those activities of daily living. So these things are going to help people, number 1, to get up out of a chair, get out of a bathtub. It's going to help them to reach for things in their cupboard. It's going to help them to be able to walk safely. And those are the reasons why we would do them. So this is what they all look like. There's chair marching, chest press. They all have very specific things that they work on for your functional mobility. So it's not like you're going to do these to run a marathon, but they're just to help you in your everyday chores or everyday activities that you do. So here's an example of one, the seated march. If everybody's sitting, this one is basically a seated march. And what you do is you sit in your chair. If you have one of those round softballs, sometimes they're great. You can put them in your back. The chair should always be up against a wall for safety. And you really need to have armrests on the chair. And so basically what the person is going to do is they're just going to sit in the chair. And if everybody's sitting in a chair and they can do that, you can just sit and you march in your chair. So you're just going to march just like anybody normal would. Can you guys see me and see me marching? So you just would be marching in your chair. And you do that for about 30 seconds or for a minute, whatever you feel comfortable, but you're in that chair and you're just marching. And if you want to add a little extra, you would add your arms so that you would be marching and you've added your arms to do that. So this is something that you can start off doing 30 seconds and then work up to doing it for like a minute in the day. Then you have the muscles that you're using are your legs, but the really important part of this is it's really functional, right? Leg endurance, it helps with, and it also helps for standing. So it just makes you stronger. So if you're waiting in the line in a store, you're waiting somewhere, and just if you're standing anywhere, it actually helps. The next one is a sit to stand. Same thing, the chair should always be up against the wall. And if you're in the chair, you're going to have the arm rests. And basically all you're doing is pushing yourself up out of the chair and then sitting back down, pushing up. And what this is doing is it's strengthening your arms. And what it's done is you start maybe doing 2 or 3 a day, And you could do this while you're watching TV. And again, like I said, if you sit, you know, either with if you are someone that has a loved one that has Alzheimer's and you sit across from them, then they can be doing and mirroring what you're doing. The benefit of this exercise is the arm strength. So it helps people for getting out of a car, getting out of bed, getting off the toilet, and it's all very functional in terms of the benefits. And this one, which is my favorite one, it's called toe taps. And basically you're sitting in a chair. Again, your feet are flat on the floor, your back is straight, and again, your chair is usually up against a wall for safety. And all they're going to do is lift their toes up and down and do toe taps, alternating feet. Now at the other section, they have the ball, and that makes it a little harder to do if you can put a ball between your ankles. So what does this do? Well, this is one of the #1 things. It increases their range of motion, and this is what assists in falls prevention, because you're training the muscles that pick up your feet while you're walking. And so your feet are coming up and you're strengthening those muscles in the front of your legs so that we don't end up shuffling along and that our feet are moving up and down in the air. And then the last one I have for you is reaching. And this is, again, we're sitting in a chair. You can have it with ball, without a ball. And all you're doing is you're reaching up as high as they can and then putting your wrist forward. So you're snapping your wrist like you're throwing a basketball. And then you do it on the outside, and then you do it in the front. So up, and then in the front, and on the side. And so and then you switch arms and you do it around. And again, this is helping to keep that range of motion there. If we sit around, and again, all these things can be done when you're just sitting in front of a TV and watching, right? So it's not like you have to, like, you know, go out anywhere. It's something you can do with your family member. And it's not, I don't think any of them are difficult, and they really help them with their activities of daily living. So there's other videos that are available. And I guess I should send those in. Come from the Canadian Centre for Activity and Aging. They put together some active at home videos because, again, during COVID, not a lot of people are going out. I think it's really important that, you know, we're trying to do something, and everyone, you know, that's used to going out, this is something that you can actually follow at home. So it's a great way to add just to some of that little exercise or fitness that, you know, is at home, and it's free. And that's always the best price, right? So basically, I want everyone to remember that they should move more. It's essential. And if you don't move, you'll lose it. And I think that's all for today. So if you have any questions, let me know. And hopefully I didn't go over time or anything like that.
You did great on time.
Awesome.
So thank you so much, Suzanne. There were some really, really great points that came up during that presentation. I think, firstly, which I haven't really thought about a whole lot, but you talk about clothing and how important it is to make sure that clothing fits. You know, oftentimes when we have a person perhaps living with dementia, and as they journey through dementia, they might lose some weight. And so clothes may not fit as snugly as it once did. And I think that's a really great point, right? To kind of draw that to the forefront of our mind, to recognize that that does play an important role in falls prevention.
Yeah, it's that whole idea about, like, even a robe, right, that you used to wear, or if you wore pants, and sometimes as men get older, they lose weight. So maybe you just need suspenders to put on because otherwise the pants are coming down low. And I think the footwear piece is a big one too, because I can say my mom, who worked her whole life as an accountant, used to wear high heels. And so when she got into long-term care, they wanted to put slippers on her. And I went, I don't know if it'll work. She ended up being in a wheelchair. So I just put the heels back on her in the wheelchair, and she could self-propel around, which made her happy. So plus her Achilles had shrunk a little bit from wearing the heels all the time. So putting her in flats wasn't comfortable for her. So yeah.
Things like that, that we, you know, we have to take into consideration who that person is. What their life was before. And so it's certainly important to remember that too. I think the other thing that you brought up that really is so important, and we try to talk about it quite a bit too, is that having that yearly check-in, right, with your family physician, recognizing as well that it's a struggle for some people, not just with COVID or the weather, but also having a family doctor. But for a person who's living with dementia and their care partner, having that yearly check-in if you haven't seen your family doc in a while.
Yeah, and I mean, the one thing too we're working on right now is, for me, it's a key piece. When you do go into your primary care physician or your primary care practitioner, that they're asking that question about falls, and they also are doing and looking at cognition, because cognition really can affect your risk for falls. So I think it's important that they're checking in to see where they are, you know, in terms of their abilities with, you know, the cognition issues.
Wonderful. Yeah. We have a couple questions that have come through. So one question is, my father has dementia and it causes him to shuffle when he walks. What can I do to ensure he doesn't fall or to help keep him safe?
So that's one of the issues that I said in terms of the shuffling. When we do that exercise where we do the toe taps. Now, if the person can help and if they're capable of doing that, obviously you could try to get them to do toe taps, because that helps to strengthen the muscles that will help them to walk. But another thing you can do too is make sure they have that proper mobility aid with them, and they might need some assistance with that. So if they're not capable of doing any of those little exercises, then yes, if they have like a well, all of a sudden I lost it, a walker. Then if they're using a walker, but again, to get a walker, you really need to get occupational therapy to come and speak to them. It's not just you making that decision, but they will fit them properly with what other walking aid they might need. And making sure that maybe there's not rugs that are laying around, because there's tripping hazards, of course, when you're shuffling, and the edge of the carpets and that kind of thing, they can get caught on them, like the scatter mats, they're all around. And so again, we don't want that in terms of, you know, somebody tripping on the edges. Make sure the lighting's good so that they can see with the lighting. Environment is such a huge piece, right? In terms of, you know, having night lights available, because if you're shuffling, you need to be able to see that, because that's one of the key things for sure people do. But keep walking, and if he is walking, it's great to keep him walking. Make sure he has good shoes. Sneakers sometimes aren't the best thing when you have a shuffle, because they sort of squeak and catch on the floor. So you might need something with a different sole that works a little better.
Yeah, that's a great point, because we forget, right? We think everybody should be in a sneaker that we can tie up and tie tight, but you forget that rubber bottom can sometimes be the cause of a catch.
Exactly. Yeah. And the tying up piece too. Often it's better just to use Velcro if, you know, and that makes things a little bit easier. Yeah, for sure.
And one of the things you touched on there that I think is also really important is making sure that people are fit for the right size. Yeah. Or, you know, if it's a cane, where should that handle be? And if it's a walker, how high should the handlebars be? You know, even, you know, people that sometimes have to have a crutch to kind of use to guide or support them, you know, making sure that things are fit for you, size wise.
Absolutely. Yeah. And even the shoe piece, right? Because I think what happens, and we did a program once in the mall, and we asked people to come and we're going to check their footwear. And somebody had been wearing the same running shoes for 2 years, and they looked like they were in pretty good shape. But when you looked at the soles, they were worn, like the treads were completely gone. Yeah. So they really need it. And I mean, your feet can change too over time in terms of size. So you want to make sure that, you know, they're fitting you. My mom, for example, again, when I went and she was having problems walking and I couldn't figure it out, took off her shoes to find out her toenails had grown so long, and she hadn't said anything, that they were actually hitting at the end of the shoe and was causing her some pain. And so, of course, we had to look into that. It's really important, like I said, with the shoes also, is making sure they don't, even socks and slippers sometimes can be very slippery depending on the floors. You know, there are grippy socks out there that are awesome to be able to use, and we offer those in the hospital also, you know, to avoid that slipping and, you know, especially when you shuffle.
Yeah. Someone had just put a little comment in to say that their mother-in-law's feet and ankles swell quite a lot. And so now they've gone to wearing slippers because of that as well.
Right.
You know.
Yeah. So slippers, when you're looking at them, there's good slippers. You know, the high heels with the ostrich feathers are like a no-no, but you can go with, you know, slippers that are actually go on their feet, not just the slip-in ones, but if you can actually put your foot right into them. So there are good slippers out there. It's just finding the right ones so that they, you know, because again, if you're walking and you have just sort of the flip-floppy ones on, your feet can slip out of those, you know, so that's something to keep up, because I know a lot of people do have issues with that in terms of swelling, and they can't even wear certain shoes. And I know that happens in long-term care quite often.
Yeah, yeah. So a second question has come in, and it says, what exercises would you suggest to maintain balance? I noticed that my sister, who has Alzheimer's disease, is having more difficulty getting out of the car when she stands up from sitting down.
Yeah, so the whole balance piece, the one that I said, sort of the sit to stand one, that's the very beginning one. And then eventually with that exercise, there's a progression that you can make that they're actually sitting down and then they're going to stand up. And so and balance. And basically even just standing and holding on a counter and doing toe taps, but always holding on. I mean, again, that helps with balance for sure, because balance and gait are really, really two things as we just normally age that decreases. I mean, for myself, I know I sometimes try to walk on the curb and I lose my balance because, again, as we get older, and vision also, depending, I'm not sure if this person wears glasses, but that's another issue, because when you reach the age of 65, you shouldn't really be wearing like the progressive glasses. You should be wearing bifocals because that can also affect it. But the exercise specifically would be just that sitting, getting up and sitting down, and even doing the toe taps, because that strengthens their legs for balancing themselves when they get up. And it might be a point whether that person might need some sort of mobility aid too, to help with their balance.
Yeah. Great point, Suzanne, again, about the vision changes as well. So we often see, you know, sometimes with a person with dementia that their vision will change as the disease does progress. And so recognizing what an impact that can have on balance and, you know, mobility and safety as well is really, really important.
And also your like vestibular balance, which is your inner ear balance, right? Because that could also be off too. And so it's, you know, we start to compensate just as we get older, as we maybe potentially lose some hearing, other parts of our body compensate. So if we can make sure we have that strength like in our legs to get up and get down, that's going to help us to sort of, when, you know, it will sort of fall into there where we're not balancing well, but because our legs are stronger, it's going to help us a little bit more.
Right. Yeah, that's a really great point. So last question that we have for you today is, what are some of the safety precautions that I can put in my home to keep safe so that when my parents come to visit, I know they're safe too?
And that's a huge question. I get that question quite often, right? I think that it's so key having a dementia-friendly home. It's just the same way as we want to have any home, you know, no clutter. Really important things are we have to have really good adequate lighting. So the more light, the better, because I think as we get older, there's not like a number on what the light should be like, but there is, if we can do that. Reducing any glare is really important, and shadows. Often, you know, we in the hospital setting, you know, we have the shiny floors, which are really a no-no. Because people think they look really, really clean, but really we don't want to have shiny floors, because quite often patients that have Alzheimer's see it as water, and that's an issue. So we don't want to have the shiny floors. I know they look good, but you know, I think we need to get away from them. Also night lights. I have my mom saying to me all the time, I'm falling all the time. And I was just shocked, because I'm like, well, what do you mean? And she goes, well, when I get up every night, I'm falling. And I said, well, you need to sit on the edge of your bed and give yourself a second, right? Just because, you know, when we get up and, you know, you've been laying down sleeping. So it's really important just to sit on the edge of your bed before you get up. And if you have a night light, you can see a direction in which way you need to go. So if it's in the hallway and you're like, okay, I can go there, because, you know, she didn't have a night light. So I got her a night light, and then she was good. She didn't have falls after that. So just little simple things. You know, our pathways are clear. We don't want to have things laying around on the stairs or anywhere else that we can trip on. The scatter mats, there's always a war on scatter mats. People don't want them there because they are a slip hazard unless they're taped down, but they're also tripping, right? Even if they're taped down, we sometimes, trip on them. You've got to figure out though something like, I know I used to say to the home support workers when they went in the homes, I would say, if you had scatter mats, what would you do? They would say, well, I'll tell them to move them. And I said, but you don't really understand why they have them there. You've got to figure that out. Like, what does it mean to them for having them there? And so this, finally they started to do that and ask people, why do you have this here? And she goes, well, because every time you come, you don't take your shoes off. So that's why I have it there. It's as simple as that, right? Mm-hmm. And so she probably would have removed the scatter mat, or if it has special meaning, like they can frame it and maybe hang it up or do something, but it's figuring out why it's there. For us to go in and with my mother, as an adult child that I am, it's very hard to tell your parents what to do because they don't want to listen to you. You're still their child, right? Even though you're talking about safety and, in the home. Another couple things, contrasting colors are very important. Like if your walls are one color and your baseboards are a different color, that really helps in terms of people being able to see and what's going on. Of course, the famous electrical cords, if you have a million of those around, somehow trying to get them put together, taped and out of the way, because they could cause a problem. Trying to keep your furniture in a very simple pattern and keep it consistent as the pattern in the place. Don't move furniture all the time. It can be very confusing.
Great idea.
That's a big one. Contrasting colors, like so in the bathroom, if you do have something in the tub, should be a contrasting color, like those little decals so they don't slip. Also, if your handrails are darker than the rest of the wall so people can see to grab it, excuse me. And even if you had a contrasting toilet seat, the cover was, the toilet seat's actually a different color than the rest of the toilet, that actually helps too. And accessibility is a huge thing, right? Mm-hmm. So visibly being able to easily reach places. If you have a low bed, that also helps. And footwear, like I said, is a really important thing in the home. And noise levels, reducing our noise levels in the home, not having music too loud, because that's also something that's distracting. For dishes, if you have contrasting colors, so if you have a placemat that's white, you don't want your dishes to be white because it's very hard to recognize. And the food colors, move them around like different colors so that not all the greens are together because there's different tastes. Small pets can also be an issue, obviously. Tripping hazard, as I know I've tripped. And not too many mirrors, because often people with Alzheimer's get very confused when they see their reflection. And so fewer mirrors are probably a better thing. And one of the key things that I've learned from a friend who went to her mom's house, who had a bit of early dementia, she checked all the food in her fridge in terms of expiry dates, because her mother was eating expired food and she didn't realize that obviously that it was, expired, and, she didn't get sick, but still it's one of those things that you have to, remember. So I think, having those kinds of things up, and there's so many other things that I could talk about, but I'll leave it at that. And yeah, I can offer you other things to look at.
Wonderful. I always say to people too, we often think about things inside of our home that we have to be careful and mindful of for safety and trip hazards and all those things. But with that dirty S word just kind of looming around the corner, as our winter comes closer,
right,
with our snow and ice, I say to people, make sure your outdoor lights are working. Make sure, you have some way to get the snow and the ice off your steps and walkways. So if you are out visiting or shopping or grocery shopping or paying bills, coming home, we have the safety of knowing that your pathway from the car to the house, is bright and lit and clean and safe as well.
And also that it's in good repair, right? Because sometimes I know steps, parts will fall off, and that they're in good repair. And one of our campaigns we've done for walking in the winter is it's really important when you are walking that you walk like a penguin. And that actually prevents falls. So you have a wider base, and then you put one foot down and the other foot down and one foot down. So you're not sort of lifting and, but it's just you walk like a penguin. And that actually helps to keep you safe too, in terms of walking.
Yeah, fantastic. It's so important, right? We forget that winter, what it can do. Undissolved salt, you know, how slippery that can be.
Yes.
Black
Yeah.
ice, how quickly it can form.
And
So
there's grippers for your shoes that you can get
grippers,
too,
yes.
which are really, it's a great Christmas gift to give someone, you know, and they can use those too.
Fantastic. Some really great ideas, Suzanne. Thank you so much. What a wonderful and thoughtful presentation that you've provided for us today, and responses to these questions and just the conversation have really, you know, been very enlightening and brought some great points to the forefront of our mind, which is so important. So thank you so much for that. And thank you for your time and your energy and your talent and your wisdom.
Thank you.
You will notice, everybody, that there will be a poll that will come up in response to kind of the end of our presentation. If you could take a minute to finish that out. You know, if you have any other questions, please, you know, take a little bit of time to sit and answer and go through anything. If you have anything that you have any questions about, any concerns about, anything you need to touch base about, anything, please call our 1-800 number at 1-800-611-6345, and that will put you in touch with our Alzheimer's information line, the Alzheimer's Society of Nova Scotia, and we can reach out and chat with you about anything that you may have heard or discussed, or if you're looking for more information, we can certainly do that for you. So please don't hesitate. And right there on the screen is the number for you as well. It's a great way to reach out with a confidential phone call, and we can support you through the course of the dementia journey as well. Just a reminder that our sessions are recorded, and so they will be posted and left on our YouTube ASNS channel, so you can watch them again. If there's something that you thought about afterwards, you know, you want to hear it again, share it with family, have family watch, we can certainly, you will certainly find it there. And so that it's a great way to come back and find that education again. So once again, Suzanne, thank you so much for sharing your time with us. Great wealth of information. And thank you everyone for joining us. Be safe and be well. Take care.
Thank you.